Hello, good afternoon, everyone. On behalf of Dentium, I warmly welcome you all in today's webinar on implant surgery from kit setup to final placement. This webinar will be informative and beneficial for those who are planning to start their implant practices. And we are privileged to have Dr. Avantika Tripathi, MDS Oral and Maxillofacial Surgery and Dentium Cable as our esteemed speaker, bringing expert technical knowledge and practical insights on the use of Dentium BRIGHT implants. We encourage all the participants to kindly stay at the end of the session to avail webinar special offer packages and a chance to win bright fixture in the lucky draw contest. Thank you for joining us again. Now over to Dr. Avantika.
Thank you, Mr. Subbaru. A very good afternoon to all of you. Welcome to today's webinar on implant surgery from kit setup to final placement. So today we are going to discuss about the BRIGHT surgical kit and its components in detail. So this is the BRIGHT surgical kit. We are going to go through all the components one by one. So this is the BRIGHT surgical kit with which we can place both bone level as well as tissue level implants. So there are liniment drills which are used for the initial marking or initial drilling of the osteotomy. So this is the first liniment drill with a diameter of 2.5 mm. The markings on this drill are 5, 7, 9, 11, 13 and 15. As the implant diameters I mentioned in the previous webinar, that the implant length available are in odd numbers, that is 7, 9, 11, 13 and 15. So the drill also has the same markings of 7, 9, 11, 13 and 15 and additional marking of 5 mm. Because we have a 7 mm implant with a polished collar of 2 mm and rough surface of 5 mm. So that 5 mm marking will help in placement of that 7 mm implant. So first we will mark the osteotomy with the initial drill, which is called as the liniment guide drill of 2.5 mm. Suppose I need to place an implant of 11 mm, then I am going to prepare with the 2.5, then I am going to prepare with the 3 mm. If my diameter chosen is 4, so I will go with the 2.5, 3, 3.5, 4, and then I am going to place my 4 mm implant. This is the parallel pin which is used to check whether my osteotomy, which I am planning to prepare, is parallel with the adjacent teeth or not, it is in proper orientation, angulation or position or not. So there is a hole in this parallel pin which is used to tie the floss, as it is a very, very small component, so patient might aspirate it if it is slipped from our hand. We should always tie a floss through it, and it is positioned inside the osteotomy after the initial drilling of 2.5, just to check whether my orientation is correct or not. Once the parallel pin is inserted, then my position is confirmed, then I am going to use the final drills of 3, 3.5, 4, 4.5 or 5 till the final diameter of the implant which I have planned. After that, after the complete osteotomy preparation, I am going to place my implant, and then after placement, I am going to insert this path pin over it. So this is the path pin which is screwed over the fixture to check whether my fixture is in proper orientation, angulation, or whatever I planned that my orientation, angulation should be. I was able to replicate that or not. Or if I need to place 2 implants, I can place I will place one implant, then I'm going to screw the path pin over it, and with the parallelism of that path pin, I am going to start preparation of the second implant. This is the drill extender. As its name says, it is used to increase the length of the drills. So if you feel like the length of your drill is unable to reach the desired depth, so mainly in the mandibular interior region, mainly in the maxillary posterior region, if it is an immediate implant placement. So sometimes we are unable to reach the furcation area properly, as the adjacent teeth will hinder the handpiece to reach the desired depth. So we can use these drill extender. If the mouth opening allows, we can use them and we can increase the length of the drill. They simply slip they can simply adapt by just a gentle push. These are the implant drivers. So now, as the Bright implant system is made very simple and easy to use, so this kit allows placement of both bone level and tissue level implants. So these the drilling sequence will be same for both bone level and tissue level. The drills will be same, usage will be in the same manner. The only difference is in the adapters. As the connection of bone level implants is internal hexagonal connection, so these are the drivers which will be used for the placement of bone level, and the tissue level implants have an external hexagonal connection. So these drivers will be used for the placement of tissue level implants. So this is the driver which is used with the handpiece, and this is the ratchet driven implant driver which will be used for placement of a bone level implant. These are the tissue level adapters. These are the tissue level adapters which are used for the placement of a tissue level implants. These are the hex drivers. So this is the hand driven hex driver, and this is the handpiece driven hex driver, which is used for the prosthetic tightening. And this hex driver can be used with the hand or with the ratchet. It can fit in the ratchet also. To the ratchet, it is a simple to use ratchet. We can simply engage our driver with it, and we can give a forward or anti-clockwise direction by turning it F or R. If we are going to turn it towards the F, it's going to move in the forward direction. If we are going to flip it and turn direct it towards the R, it will go in the reverse direction. Reverse is to remove the fixture. If I need to change, suppose after placement I feel like my orientation is not right. The placement position is fine, but the orientation is wrong. So I can simply remove my implant and I can reorient it with the help of the ratchet and driver itself. This is the depth gauge. Depth gauge has two ends. One end is broad, which is used for measuring the gingival height, and this is the thinner portion which is placed along the wall of osteotomy to measure the depth of the osteotomy. It can also be used to measure if I'm going to extract a tooth and place an immediate implant and I need to measure the socket depth. I can take help of this depth gauge. It also has the same markings which are there on the drill. So the markings will be 7, 9, 11, 13, 15. So we have to, when after complete placement of my implant, my bone level implant and my tissue level implant will look like this. So we have to understand that a tissue level implant has a gingival height which will be at the level of gums, at the level of gingiva, and this portion should be visible in the oral cavity. This is used for the fixation of the abutment over it. The bone is if the bone is very hard, then we have to, if the bone is very hard, then we can use the next drill as the countersink drill for the coronal preparation of the osteotomy for smooth insertion of implant. If you feel like the bone is of D2 or D3 quality, then there is no requirement of countersink drills. We can simply use the same sequence and place the implant. If you would have seen that there is no 2 mm drill in this kit, but in the tissue level implants, there is a 2 mm implant. So how to place a 2 mm implant if the 2 mm drill is not there? We just have to do decortication with a 2.5 mm drill, and we can simply place a 2 mm implant. So we just puncture the cortical bone with the 2.5 mm drill, and we are going to insert our 2 mm implant. So 2 mm is a very thin implant, so it is mainly used in the maxillary or mandibular anterior region. So we just have to puncture the cortex and place a 2 mm implant with minimum preparation. This is a short video of placement of bright bone level implant in the dummy model. First of all, we are going to use the 2.5 mm drill. The drilling speed which has to be used is same. It is like any other system's drilling speed. It has to come in the range of 800 to 1200 RPM depending on the bone quality. If the bone is soft, less speed. If the bone is hard, more speed. We are going to mark the osteotomy with the initial drill of 2.5 mm. Then we are going to put the parallel pin to check whether the orientation or angulation is correct or not. Then we are going to insert the second drill of 3 mm, then 3.5 mm, then 4 till the final drill. It has a green band on the neck of it, so it is a 4 mm drill. Once the final drill is done, here I am going to place a implant of 4 mm diameter. So I am going to place the implant directly after doing the 4 mm drilling. After complete insertion of implant, I am going to remove the implant driver. The speed for implant placement should not exceed 50 RPM and the torque should be kept of in between 35 to 50 NCM, not more than that. The ratchet, we can simply place the implant or further insert the implant with the help of ratchet also. Then we are going to screw the path pin over it to check whether the implant's orientation or parallelism is correct or not. Then we are going to unscrew this parallel pin with our hand. There is a hole in the path pin also, which is used to tie again a floss. So whatever instruments we are to be used with our hand always have a hole inside. So we should always try a floss, because if it slips, there is a high chance of aspiration. Then we are going to insert the cover screw to cover the fixture from the top. With the help of hex drivers, we'll put the cover screw. So this is the complete placement of a bright bone level implant. Now we will see the placement of a tissue level implant. So for the tissue level implant, we are going to start the drilling procedure. This is the drilling procedure will be same. This will be the Lindemann guide drill of 2.5, 3, 3.5, 4, check whether the drilling is parallel with the adjacent. So whenever we are going to place multiple implants, our drilling we should always place a path pin on the first placed implant, so that the second placed implant will get a better orientation. It has a yellow color band, so the diameter of this drill is 3.5. We are going to use the 4 mm drill, and then we are going to place the implant. So this is the implant driver which is used for the placement of a tissue level implant. We are going to set the motor, change the program for the tissue level implant, and then we are going to place our tissue level implant. So this is a tissue level implant. The implant's shape is beautiful. As you can appreciate, it is a dome-shaped implant with aggressive thread design. It is going to provide a very good primary stability to the fixture, to the bone. Yes, to the fixture. So we are going to remove there is a very, very small white color cap on the top of this fixture. So we are going to remove that white color cap, and then we are going to place the comfort cap over it. So this is a very small comfort cap. Like a bone level implant has a healing abutment, so a tissue level implant has a comfort cap just to prevent injury to the surrounding structures with the sharp margin of the fixture. We are going to put this over it, and over the bone level implant we are going to put the covers. To this, the procedure is complete. This is a case of placement of a bright tissue level implant. So this patient has a missing 1-1. So I'm going to give two releasing incisions, one crestal incision, and then I'm going to raise a trapezoidal flap. Once the flap is open, then we will see that there is very, very less amount of bone. The bone thickness is very less. So I planned placing a bright tissue level implant. So with a single drill, I placed a 2.5 diameter implant. So it is a very, very simple to use implant, and because of its aggressive thread design, it can smoothly go inside the osteotomy. Once it is gone, then we will see that there is a slight crack on the buccal wall. As the implant is exactly of the same diameter of the bone, so I plan to bulk the bone with artificial bone and some amount of natural patient's bone, autologous bone. So I decorticated the area and I prepared the flap. So I did periosteal scorings and I increased the surface area of the flap to achieve primary closure. Then once I felt that my flap is good to go, I will be able to get a good primary closure. Then I extracted some amount of patient's bone, the autologous bone from the ramus region. I scraped some and I used the drills as harvest drills. So I extracted some amount of bone and then I used it as a bone graft. So I combined first layer I placed with the autogenous bone, and the second layer was of xenograft. After this, once the bulking was done, once I was able to achieve good volume on the buccal side, then I stabilized this bone graft with the membrane and membrane pins. So collagen membrane, Dentium's collagen membrane and membrane pins from Dentium were used with this pin insertion tool to stabilize the membrane. After that, primary closure was achieved, and this is the X-ray of the same patient. So at last, I would like to say that this BRIGHT implant system is a boon for those patients who have very, very thin, very, very thin amount of bone, as with minimum amount of surgery and with minimum amount of preparation and minimum amount of bone augmentation, we will be able to achieve good results. So if you are planning to place an implant in the anterior region, Where the bone is very, very less, this implant system is a bone for you. Thank you so much for your patience listening. If you have any questions, you can ask.